First and foremost, I would like to say thank you to NURHI. They've been really helpful in the space of the family planning space in Lagos State. And I would like to say that as a state, we have welcomed this partnership. We're very hopeful that there are things that we as a state will be able to sustain.
We had a program that had to do with reduction of maternal and child perinatal deaths in the local governments. And we used that same avenue to introduce the uptake of family planning as a method, as a major strategy in reducing the maternal deaths and in saving and promoting safe motherhood.
The reason why I take family planning is that I don't want to be having anyhow pregnancy. I feel well to take care of my children. Even my business, it gives me time to do my business.
Since when she took up this method of family planning, there's nothing like we are thinking of unwanted pregnancy, all sorts of things. So we are free our mind, and me and my wife can be able to enjoy ourselves as a husband and my wife.
It is my passion to ensure that a woman like me, women like me, young people like me live their lives and they are not careless about their reproductive health, because family planning saves lives.
At the inception of the NURHI project in Lagos, we conducted a landscape study that showed that a lot of Lagosians still had religious bias against family planning. So that necessitated the action to institute the Interfaith Forum to bring together the Christian faith and the Muslim faith together to chart a way forward for family planning in Lagos State.
Because a lot of them came from different community groups. They went through several trainings. One of them is the Spitfire training.
Before the training, I preached against family planning. But when I went for the training, I discovered that most of all these misconceptions that we are holding, they are just erroneous theories. So I have to drop it. Then embrace the teachings. Then through that, I am able to speak to many of our ministers, that even senior ministers.
You know, majority of the people in Nigeria, they believe in religion. They believe in what their imam or their fast says. So if we go to them, we talk to them so that they can help us in talking to the congregation on family planning and childbirth spacing.
As of today, in the past 3 years, that they have actually started working actively. They've reached over 900 clerics within the 10 LGAs in Lagos State. We've been able to track over 82,000 people that they have also reached with family planning messages.
When the project started in Lagos State in 2015, we met an existing body at the time called the Lagos State Advocacy Working Group, which was set up with support of a partner, Pathfinder, with the Lagos State Ministry of Health. It was a body set up to advocate for increased commitments towards family planning by key policymakers and decision makers at the state level and at the LGA level. When the NURHI project came on board, we decided that it was important that we do not create a vertical advocacy core group, but instead build on the existing structure that we met in Lagos State.
They actually expanded the scope of our activities by widening the scope of our advocacy to about 10 local governments out of the 20 local governments in Lagos State, and especially with regards to advocacy to the local government chairmen, the policymakers, and also to the states as well.
We thought it would be best for us to strengthen them and improve their advocacy skills, which was what we did. Now the group has transitioned to the Public Health Sustainable Advocacy Initiative.
Previously, there were even no family planning funding at the local government level whatsoever at the local government. But from about 2015, we started having a few of them, especially notably from Lagos mainland, started putting in some funding for family planning, like 20,000 naira. At the State Ministry of Health, there have been also steady increase in family planning allocation. And from 2017, for the first time as well, there have been specific budget line items for family planning itself, disaggregated from the reproductive health, where it was grouped.
We really have to give it to NURHI, because they have actually supported the PHC board to ensure that we have improved and increased funding for family planning through advocacy. When NURHI came on board with this project, we are budgeting about 22 million in the state for family planning. So our budget is now 187 million for family planning in Lagos State.
And still using the PSHI platform. They've also been able to institute town hall meetings. The town hall meetings had always been something that the state uses in reaching the people within the different communities. But now, they are now ensuring that FP messages are included in town hall meetings.
As different statistics and surveys conducted in the state has revealed that family planning program, when effectively done, can lead to a reduction of maternal deaths by up to 34%.
There is no way you can generate demand if you don't go there to tell people that look or market your product. They've gone far, they have a lot of innovations. They've gone to TV, radio.
We had a program called Sherigbo. Sherigbo is a radio magazine drama that talks about life generally, where FP experts will be on ground to talk about your challenges based on questions that you have people have raised, and then to also ensure that a lot of myths and misconceptions are also debunked.
We saw that for women who had listened to the Sherigbo program or listened to the TV spots, were at least 26% more likely to use family planning, while those who had listened to Sherigbo and the radio spots were 81% more likely to use family planning. We realized that if we needed to be impactful as we would love to be, going into social media would be able to reach that core audience of mostly youth and adolescents to be able to drive home the message of family planning.
The hashtag Every Friday is a Twitter-driven platform where different people come every 2 weeks to talk about different issues as it affects family planning, as it affects health, as it affects adolescents and youth. We started with just about 286,000 impressions. It grew to as high as 10 million impressions.
Protecting one against unwanted pregnancy.
The major strength of NURHI had been social mobilization and demand generation.
And what we do, we go from door to door. We do neighborhood campaigns, that is door-to-door campaigns, house to house. We move from people to people, shops to shops, doors to doors, to talk to people about family planning. We bust myths and misconceptions. We lead them to the facilities as well to make them go to the health centers to adopt a modern family planning method.
At Okoka PSC, our family planning clients is very high. More especially during outreaches, because our mobilizers go to the community to mobilize for us and pull out more crowd.
Apart from reaching out to over 1 million people, we've been able to refer more than 188,000 people to visit family planning centers in the different places where we work. So at the end of the day, we've been able to get 115,247 completing referral.
I want to talk about the 72-hour clinic makeover. It's an entire makeover of the family planning unit, and sometimes even extend to the entire facility within 3 days. So during this period, the community is involved. They are the ones that actually get the artisans that work in the facility. And the good thing about this is it creates a buzz in the community, especially even the commissioning, because usually the commissioning is done on Monday and is usually by the LGA chairman.
By the time the NURHI 2 came, within 3 days, we started this renovation Friday. Then Sunday we finished. On Monday morning, the new place was equipped with instruments, the consumables, the chairs. I was so happy.
NURHI supported the board. We collaborated to train 5 family planning managers as trainers. And we have actually together trained over 500 healthcare workers, both clinical and non-clinical. And we have actually had training on data management, not only on service delivery.
We had it in mind that one day the project will come to an end. We are of the opinion that once we leave, this advocacy core group would continue to advocate for family planning going forward.
We recommend that the local government's management or council should take over, should take where the NURHI stopped, so that they will provide enough consumables. They will give us enough data tools like client cards, and they should make the family planning free.
And we intend to ensure that we sustain this, and we also integrate it into the outreach services that we are currently rendering at the board. Just to express the appreciation of the Lagos State Government and the Primary Healthcare Board, to Bill and Melinda Gates Foundation, to Johns Hopkins University, and to NURHI for the support that we've had over the last 4 years.
All of this would not have been possible without, the immense support that the Lagos State Ministry of Health has given to the project. I'd also want to thank the efforts of other line ministries in Lagos State. And lastly, I will not forget to thank very immensely the very loyal, dedicated and passionate staff of the NURHI Lagos office, and even the NURHI Abuja headquarters, for the support and the leadership that the management of NURHI has provided to the Lagos State office in ensuring that we're able to carry out all of our interventions and implement our strategies as planned.